You really do. You got to keep going back to the story. Yes, exactly. Now, take your Oh My God packet, and I want you guys to turn to page 22. So what I've done for you on page 22 is I've instructed you on how to take this case study seriously, right? I've instructed you on what the hell are you supposed to be looking at when we talk about recognize and analyze, right? So with the recognize, what are you looking at? You're looking at age, gender, history, risk factors, vital signs, labs, test result. Is the family even present and, supportive? Medical record review, blah, blah, blue, blue, blow. Now, let's take an example. Let's just give you one thing and two things in recognized cues. 16-year-old female. Are you with me? That's all I gave you, right? So that was a cue. That was just a recognition of a cue. You did not analyze it yet as a nurse. If you analyze it, which is in the next section, number 2, this is where you take what I gave you and you interpret, diagnose, analyze systems, take that history, labs, test results, and risk factors for relevance to formulate a diagnosis or the possibility of complications and pathophysiology. So I only gave you 2. I mean, I wasn't trying to crowd your head. It's after lunch. I gave you 16-year-old female. Now let's analyze that motherfucker. They at your hospital in the ER. What do you think of when you hear me say 16? Just deal with that. A kid. Consent form. Need adults. Where the fuck mama at? You feeling me yet? You analyzing. Remember, because in the beginning I said where the family at. Okay, you feeling me yet? Okay, so we got 16 up in our ER. We might need consent depending on what the hell's going on. Are you still with me? Now let's do 16-year-old female. Now what do you think? Pregnancy, STDs, domestic violence, trafficking. If you minimize a little bit of that and just keep your life simple, you know good and damn well you're running a pregnancy test before we do anything. You see how that worked for you? Now let's switch up the game. 16 female complaints of abdominal pain. Oh shit. What could it be? Pregnancy, ectopic, PID, tubal, whatever. See how you add into the analysis of the situation? But you had to recognize that 16 and female in the same sentence was some serious shit. Okay? That's how I need you on this damn test. That's why your little ass ain't doing nothing too fast. Okay? All right, y'all. Let's go on over here to page 2 because we on page 2 now. Okay, page 2. Grey's Anatomy, season 1, episode 2 on Netflix at 11:15. The nursing notes are the same, nothing different. The vital signs are the same, nothing different. What's different? The 12 o'clock note. It says here in nurse's notes at 12 o'clock, Dr. Burke notified of vital signs, episode of circumoral cyanosis, and physical assessment findings. Dr. Burke ordered a chest x-ray, EKG, and an echo with a CMP and CBC. Let's talk shop. What was the purpose of the x-ray? To check for pneumonia or fluid in the lungs. This is a baby. Normally x-ray looks at bones, but in respiratory issues, we're looking for crackles. We're looking for fluid in the lungs. We're looking for consolidation. We're looking for infiltrates. We're looking for that. If it was COVID, I'd be looking for opacities, okay? So it just depends, right? So we is going to check that out because we want to know what the hell's going on. And you could even see some real obvious abnormalities in the heart. In fact, you could see an enlarged heart. Does that make sense? Okay, so X-ray is useful. What would an EKG tell us? Arrhythmias, right? So you're good, you're doing fine. And then the echo is going to show the anatomy and the physiology of the heart. Remember on your test that an echo is non-invasive and you need a warm ultrasound gel. Just remember it like that. It's non-invasive, and basically it's like an ultrasound of the heart, but it's called an echo. So you're going to need to prepare with warm jelly. So that ultrasound gel, warm it up. It's a baby, damn it. Okay, y'all good? Now, it says CMP and CBC. Now, my nurses are smarter than most, so let's just go ahead and rock it. We got a CMP. Please write this out. That's a comprehensive metabolic panel. That's going to be a mint green tube. Mint green tube. And you are going to look at these organs. It gives you insight on these types of tests. Liver, kidneys, electrolytes, and blood sugar. I'm gonna say that again. Some of y'all ain't writing. That's your fault. Wake the fuck up. So here we go. CMP, comprehensive metabolic panel, is gonna give you insight on the liver, the kidneys, the electrolytes, and it's gonna give you a blood sugar. Okay, babies. Now, the CBC, complete blood count. So we're going right back to our red, white, and blue. What are we looking for? Anemia, neutropenia, thrombocytopenia, ant. We're making sure there's no ant going on up in here. Okay, so we're looking at the red blood, well, not really the red blood cells, but the hematocrit and hemoglobin. We're looking at the white blood count. We're looking at the platelets. Are you still with me? Yes. Okay, so that's the workup of this baby. Okay, now here we go. This is where you got to put your analysis hat on your head. And it says, question number 2 out of 6, clinical judgment, analyze cues. It says the nurse recognizes that the following maternal risk factors can place this baby at higher risk for congenital heart defects. Select all that apply. Let's do it together. Do you think smoking? Yes. Hail to the double yes. Now, let's make sure we know the effects of a cigarette. Name the effects of a cigarette. What does it do? Very nice. It vasoconstricts. When you vasoconstrict, you cut off blood flow to organs. Okay? So there is that. Now, what else does a cigarette do? This is much harder because y'all usually get that one right. What else does cigarettes do? Oh, by the way, make sure you know it vasoconstricts for 1 whole hour, each cigarette. And that's what I'm trying to say. What is it when you don't smoke but somebody around you does? Secondhand. That's secondhand smoke too, by the way, which is why you a low down dirty dog if you smoke in front of a pregnant lady. Secondhand smoke does the same shit. Okay, now so that's that. What else does it do, y'all? What'd you say, sweetie? Very good. It activates platelets and causes clots. Absolutely. It activates platelets and causes clots. Very nice. What else does it do? One more thing, 3 things.
Decrease your immune system?
Yes, it decreases your immune system, making you very prone to cancers and infection. So 2 big cancers related to smoking: cervical and bladder. Most people don't know that. Okay, so we good. We know smoking is some bullshit. Okay, here we go. Use of ACE inhibitors for essential hypertension.
Yes.
Yes, because that is a teratogen. Make sure you write that word. ACE inhibitors are teratogen. T-E-R. Well, they cause harm. Everything crosses the placenta except for insulin teratogen. But these actually cause harm. So that's why it's so critical for someone who's pregnant to talk to somebody immediately when they find out they're pregnant. The problem is these old sorry ass OBGYN clinics don't want to see you until you farther along because of the whole abortion thing if you miscarry. So in my case, I would see my patients as soon as the fucking test was positive. I want you in my office because I want to find out if you have a high blood pressure history and sitting over there with Lasix and HCTZ and all the stuff that you can't take no more. I want to find that out, among other things. Okay. All right. So this is the thing. Rubella non-immune status.
No.
Everybody good?
Yeah.
Yes or no?
No.
Yes. You're not immune to rubella, and rubella will give you a heart defect. So let's talk shop. You remember me telling you that measles was the most infectious disease on earth. What was the other name for that? Rubeola. Rubella is completely different. Rubella is a whole nother childhood disease that is so catastrophic to pregnancies that congenital heart defects, you also have the issue of blindness and deafness and all this crap. Is way more of a problem with pregnant women than rubeola is. So when it comes to rubella non-immune, it means that either you never been vaccinated or your vaccination wore off. Now, more than likely, it means you were never vaccinated because these vaccines last forever when it comes to MMR. Now, so if you weren't vaccinated and you have this child, we know that there's a possibility that you were exposed. It's very rare because at some point we had almost gotten rid of all of these damn diseases before COVID came and y'all lost your goddamn mind and stopped doing any vaccines. So now we seeing all of them pop back up. Everything is popping back up. I'm praying I don't see polio because that's just going to be a damn shame that we got paralyzed kids because y'all done been scared stupid on some COVID vaccine. Okay, so when it comes to rubella non-immune, what needs to happen with this patient? And believe me, this is on your test. What do we tell this patient? She's rubella non-immune in pregnancy. Let's say that it's her first couple visits with me and her test come back rubella non-immune. What am I going to tell her? She needs the vaccine when? This week? Next week? Today? Immediately? Y'all killed the baby. After birth. She can't get this. Measles, mumps, rubella, varicella. Woo! Y'all remember MMR and varicella can't be given to pregnant women. Don't fuck around and kill their baby. So measles, mumps, rubella, varicella. Woo! That's what you got to remember on the test. And y'all do be singing. They be stopping y'all too. They be like, because y'all be singing. Okay, now, so you know the song. They cannot get this until after birth. Is it safe with breastfeeding? Yes. Make sure you know that. Okay, so they can get it postpartum. It's safe with breastfeeding. But now what they going to do during this pregnancy, tell them frequent hand washing, avoid other people's children if you can. because they have no protection at all. So yes, this is definitely a reason for why this baby could have a congenital heart defect. History of genital herpes in college, yes or no? No. So no relationship at all. An episode of partner violence during the first trimester. No. No, that's a damn shame, but they can't get a heart defect from that. Okay, and let me say this about that on your test, because you got to know this. You never, ever, ever, let me add a couple more. Never, ever, ever, one more. Never, ever, ever tell a patient being abused to leave. That is the number one time when they're killed, including my little cousin, who we was saying, where's she at? Where'd the little girl go? Oh, I don't know where she, oh, there she go over there. She looked like my little cousin. She came in, that was my little cousin. So she was supposed to leave and go to California for her big modeling debut. And she was prepaid with the check and everything. She's supposed to go to California. Her plane was to leave at 6 a.m. She was brutally murdered by 2 a.m. So when someone leaves, that is the highest risk time when they're murdered, okay? The other thing I always tell you, because there's a bunch of damn women in the room, might as well get it out of the way. If you have ever been strangled, the likelihood that you're going to be killed is 1,000 times greater. If they put their hands around your neck, the likelihood that you will be killed is 1,000 times greater. So that's for now, yesteryear, and the future. Somebody put their hands on you, you know this ain't gonna work, because you just heard me say that person has 1,000 times higher risk of being killed by that same person. Okay, those two, strangulation, just even, I don't even want you to fucking play with me. Don't pull my goddamn hair, don't strangle me. What kind of sex you doing? Why is that cute? Now, I might like to be spanked. Stay focused. But you choking me and shit? What the fuck? You seen some shit in a porn flick, now you done got carried the fuck away. Okay, Cherie. Okay, y'all need to stay serious. This is why I can't even teach. Jesus. Now, this one says an occasional glass of wine during this pregnancy.
Big no.
That's a big fucking no-no. So yeah, this is a problem. Now remember, here's what you got to remember. No amount of alcohol is safe ever in pregnancy. Let me tell you what the deal is with that, because you got a whole bunch of people that think they can drink a little wine and they third trimester. Fuck you. You ain't drinking no goddamn wine with my grandbaby. No, you ain't. Now, so let's talk about shot now. Here's our problem. We are never guaranteed a normal baby, even if we do everything right. Let that baby that you told that patient it was safe and okay to have a little champagne at her sister's wedding, let that damn baby come out messed up. You getting sued. Because in everything you read, it says no alcohol. You ain't her sister. You a fucking nurse. You don't give instructions like it's okay to drink in pregnancy. Ever. Now, truthfully, would it probably hurt her? Probably not. But now you're a professional. You don't get that luxury. You ain't the neighbor with no fucking clue. You are a professional. So if you told her, oh, I'm sure it won't hurt anything to have a little wine at your sister's wedding, you're 39 weeks. And her baby come out with a problem, she's got a open and close shut case. What do I call that? Blank check. How many zeros you want? Because you told her it was okay. And you know good and damn well in your professional mind, no the fuck it ain't. It ain't okay. Okay? All right, so think about it like that. Don't think about yourself, baby girls and boys, as regular lay persons. You are in lawsuit heaven. And babies come out fucked up and ain't nobody do nothing wrong. And it's so sad when that happens. Because nobody did nothing wrong. Okay? All right, so you got to know that. All right, now the next one says a lupus exacerbation during this pregnancy. No, that doesn't play a role. Pre-existing diabetes, which means you had it before you got pregnant. Yes, number one. Now, I need you to literally write that. I need you to write number one cause of heart defects. And here you go. Number one cause of heart and GI defects is diabetes. Whether it's in the pregnancy or without. Whether you had it before, you had it only in pregnancy. Number one cause of heart defects and GI defects is diabetes. It is the worst thing you can have in pregnancy. Okay, the next one says brother with trisomy 21 and a few unknown anomalies at birth. Yes, absolutely. Absolutely. So let me give you an example. Let's see. So we went to school with Halle Berry and Heidi Berry. Her sister's kids is my kids' cousins. So when she had one of her sons, the nurse, the labor and delivery nurse, came in the room. Labor and delivery nurse, because the labor and delivery nurse does the first physical of the baby, and said that the baby had a simian crease. What is a simian crease? What's a simian crease? It's the crease that completely goes all the way across. Now look at your hand and notice that you don't have a line that goes all the way across. However, I have had students in class with one. I had one with one. I did. She was totally normal, but she did have a simian crease. So if you look at your hand, this crease would go directly across, all the way across, no separation. Just go straight across. She told Heidi, okay, Heidi, you got a simian crease. This baby has a simian crease in their hand. I'm gonna let the pediatrician know. And she kept it simple, but she got the car wheels rolling. And I was sitting there when she said it. That's how come it's so poignant to me, because the nurse was like on her shit. So the pediatrician came in and said, the labor and delivery nurse brought up the fact that the baby has a simian crease. He doesn't have any other features of Downs, but she was breech. So he said, we're going to do some tests just to check. We'll draw some blood, blah, blah, blah. Sure as shit, that labor and delivery nurse was on her shit. Down syndrome. He did not look like a baby with Downs. So when you see this on your paper and it says, brother with trisomy 21 and a few unknown anomalies at birth, this baby could be not only a congenital heart defect, but also trisomy. You see how that goes? Because it's genetic, right, guys? Okay, very good.
They couldn't pick that up in utero, that the baby?
Down syndrome, no. Although she was, at the time, 36, they did, at the time, offer her an amnio. She was like, no, because I don't care what my baby got, I'm keeping it. And so that's what we did. Little sweetie pie baby. Okay, now, so y'all good? Y'all saw how we did that analysis? Okay, so we're moving on. Now, page 3 of your case study. At 1500, we just got some diagnostic tests and procedures back, y'all. It say on the chest x-ray, right ventricular hypertrophy with a boot-shaped heart. Ooh. Then we got the EKG. It is saying sinus tachycardia, 178 to 190s. Well, damn. Then the echo says right ventricular outflow tract obstruction, overriding aorta, mild pulmonary artery stenosis, and a fucking ventral septal defect. Oh my God! Jesus! Now, let me tell you something, because I put this here for a reason. Okay, children, I put it there for a reason. I put it there because you had to know that all 4 of these tetralogy of Fallot. Okay, now you know how you're gonna remember tetralogy? Watch this, baby. Tetra means 4. That means 4 defects in one child. Tetra means 4. Okay. Alrighty. Let's look at laboratory results. You're going to say yay or nay together with me if you like it. Yay, we like it. Nay, bitch, we don't. Y'all got it? Okay, let's do it. This is the baby now. Don't get lost in the sauce and think it's a teddy bear or some shit. We still doing the same damn case study. Okay, so glucose 52. Yay. Yay. Okay. Sodium 138. Oh, I heard a bunch of no's. Y'all don't.
135.
Thank you, Boo Boo Kitty. Yay! Y'all motherfuckers don't know your labs. I see you. Okay, now listen, children. Let me tell you a little something, because y'all on some bullshit. Here's the deal. When you take this test, you will not have to know your values. When you leave that test, motherfucker, you will.
Right.
Your job, my job, the Cleveland Clinic #2 hospital in the world, don't give you fucking normals. They expect you to be educated enough to know them. So you gonna look real stupid if you get there your first day. And I send all of y'all there that I can, because it's the kick-ass job and you'll be able to go anywhere in the world with the Cleveland Clinic on your resume. So I start you off right. We get your jobs now, that ain't no issue. So you can't walk up in that motherfucker and be talking about, I don't know about that. 138, I don't know. No, they gonna be like, she got to go. Shelly, she took you? Oh no. Okay, so come on, we're gonna learn it. Just put 135 to 145. Y'all good. Okay, now calcium. Yay or nay?
Yay.
Yay! It's basically 8 to 11. Magnesium.
Good.
Yay! Now, I got a way to to teach you the trick. So don't worry about these little funky ass electrolytes. I got something for you. Don't worry. Okay, BUN and creatinine.
Good.
You skipped potassium.
Did I? Oh, let's do potassium first, y'all. Sorry. Potassium. Yay or nay? Yay. BUN.
Yes.
Well, and it's 10 to 20.
Yeah. Or is that in adults?
Oh, that is adults.
What is it in the
I
baby?
don't know.
If you were to think about it and look at it carefully, what would you lean towards?
No.
It's kind of high, ain't it? It's kind of high. I'm going to teach you that too in a minute. So hold on. I got some tricks for y'all little brats. Okay, but creatinine,
Good.
it's good. Albumin. You don't fucking know, so let me tell you. Here's the way albumin works. Put some notes down. Put nutrition lab. Albumin is a nutrition lab. And when you think of nutrition, the old-fashioned thought was that you needed 3 meals a day plus snacks. Are you with me?
Yes.
So normal albumin is 3 plus snacks, which is 3.5 and up. That's how you're gonna remember that. So 2 is undernourished. 1 is real severely malnourished. 3 meals and some snacks is 3.5 and up. Okay, so that's how you're gonna remember it. So we good, right, y'all? Billy Rubin, who gives a shit? I don't. But it is abnormal. ALT, AST, ALP, you don't care. That is liver studies. Just understand that those are liver studies and you'll be fine on the test. They don't get too crazy on the test about liver studies, but they do see if you know that ALT and AST is liver studies. Okay, white blood count 7,100, yay or nay? Yay. Hemoglobin and hematocrit 17 and 49, yay or nay? Yay. Platelets 302,000, yay or nay? Yay. Direct Coombs test, negative? Yay. You don't want positive. Okay, this is the RH and all that stuff. Okay, now listen to me. That was your labs. We'll go into that in your little oh my god packet. But it says question number 3 out of 6. Where are we now? Prioritize hypothesis. Check to specify if the findings below are consistent with congenital heart defect or respiratory distress syndrome. Each finding may support more than one. Are you with me? Okay, so let's do it together because this is kind of easy. Infant delivered via C-section. Respiratory distress, but not congenital heart anomaly, right? In other words, just because you were born by C-section does not put you at risk for a congenital heart defect. But it absolutely puts you at risk for respiratory distress, okay? All right, maternal diabetes. Both. Because they're so big, they don't even know how to breathe. So they are, and they can be big, but still be very premature internally. Okay, EKG, sinus tachycardia.
Congenital.
Both, very good, both. Okay, hypothermia.
Neither.
Both. Here's what you need to know. If I'm not getting that much oxygen, I'm going to conserve what I have and I'm going to let my temperature drop and not be able to bring it back up because it takes circulation and energy and oxygen to get your temp up. And so if I'm a baby and I'm like having problems because of a congenital heart defect or respiratory distress, I'm going to get cold because temperature is the least of my concern. I need to get the oxygen to the brain. Okay, so it's kind of like compensation in a way. Okay, irregular respirations. Neither. That was normal, remember? Echo results. You think that echo was normal? It was tetralogy of Fallot, so which one? Congenital heart defect. It ain't no respiratory issue. Echoes are hearts. Remember, echoes look at your heart. Maternal age of 40. Congenital heart defect. Hypoglycemia. Both. Very nice. Nasal breathing. Neither, because it's normal. Positive murmur. Congenital heart or normal, either way. Chest X-ray results. Yeah, you can have a murmur when it's normal, and you can have a murmur when you have a congenital heart defect, right? So it's normal. It's not alarming, but you could see it with a congenital heart.
But I thought you said that was normal too, so
well, you have to what I tell you when you're doing NCLEX questions. This is a whole nother question. That was for that. Recognizing cues. It's not an abnormality. Can you have a murmur with a congenital heart defect? The answer is yes. So you can't be an absolutist. You still have to analyze the question for that question's sake. Okay? All right, guys. Chest X-ray result. Congenital heart defect. Definitely not respiratory. So that's pretty much how a case study would go for a newborn. They're going to give you congenital heart or something respiratory. Okay?